Normal pregnancy will have in about 80% of pregnancy. 20% will be complicated pregnancy. And the complication can be either gestational diabetes, can be hypertensive disorder of pregnancy, can be fetal growth retardation, even preterm labor, even intrauterine death. All these pregnancy complications are extremely important. They usually develop during the second half of pregnancy, and if we don't treat them right, there are short-term effects and there are long-term effects. The short-term effects are crucial because they can actually even interrupt pregnancy. They can cause intrauterine fetal death, they can cause preterm delivery, prematurity, which is a huge burden on our lives, but it can also have a very long-term effect. And the long-term effect can affect the fetus and the mother. A mother that has GDM, gestational diabetes, she has a chance of about 50 to 80% to become type 2 diabetic in about 1 to 5 years after the current pregnancy. She can even stand a higher chance of having cardiovascular disease. The fetus has the same problem. It can have short and long-term complications. So the fetus will stand a chance of being obese, type 2 diabetic, cardiovascular disease, and many other conditions. Preeclampsia. Preeclampsia is hypertensive disorder of pregnancy. Preeclampsia, the incidence of preeclampsia is about 8 to 10% in all pregnancies. Preeclampsia, again, not treated, not diagnosed, and not treated properly, can cause short and long-term effect on the mother or on the fetus. Very similar to what happens in GDM. So we have to identify, we have to treat, and more attention is being paid now using new technologies to predict complications, to predict disease. Now the big issue is prediction and prevention. Instead of diagnosing and managing, we have to try and predict the complication. If we predict the complication, we can try and prevent it. So there is a huge amount of data now coming that can give us a hand in predicting conditions like gestational diabetes, like preeclampsia, like preterm labor. And it's emerging now. And all of it thanks due to new technologies, to big data, artificial intelligence, what I call the Omics, the microbiome, proteomics, microRNAs. All of them are new emerging technologies, and directed properly towards conditions and women's health, we can actually bring solutions to many unmet needs.